Hello and welcome to Basic Spanish for OT, PT, and SLP clinicians. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will leave a link on the channel. On today's video, we will continue with basic questions and commands, and we will be on page 85. So I invite you to turn there now. If you don't have a copy of the book, let me take this time to encourage you to have a copy with you. It will make following along so much easier. If you don't have a copy, it may seem as if I'm all over the place, but if you have a copy, you can see why and how I'm referencing where I'm going. So with that being said, vamos a empezar. The first question on page 85 is, do you feel worse? Common question that we'll ask a patient all the time. We're hoping that they're feeling better, but sometimes you're going to ask, do you feel worse? So that would be, ¿te sientes peor? ¿Te sientes peor? ¿Te sientes peor? And again, visual cues sometimes are very helpful. Not sometimes, all the time. They're very helpful. Sometimes, when you give that face like, that kind of face, my face looks like something is wrong. So if you're asking, ¿te sientes peor? So they would understand. You're like, something doesn't look right. Are you feeling worse? Even if you don't get the peor correctly. But to say it, remember, we are aiming, consistently striving for progress with Spanish. So I don't want you to think that learning Spanish is something that you can just kind of blow off. But being perfect is not what we're going for. We're consistently striving for progress. And if you haven't heard that, I got that from Dr. A.R. Bernard. Consistently strive for progress. The next one, do you get dizzy when you change positions? This is a question we will ask because many patients are orthostatic. When they're laying in supine and then they go to edge of bed or from sit to stand, either blood pressure drops or maybe heart rate drops or increases or something happens that causes them to feel dizzy. So, ¿te mareas cuando cambias de posiciones? ¿Te mareas cuando cambias de posiciones? ¿Te mareas cuando cambias de posiciones? So many times, again, you can do this is a visual cue. They understand, even if you can't get that word mareas correctly, doing this, they realize that you're saying, oh, I feel that looks like I'm saying woozy. Am I getting woozy? That kind of thing. Okay. The next one, do you have a full bathroom on the first floor? And I'm going to change this, the light in here. It just got a little bit too bright. Much better. Okay. So do you have a full bathroom on the first floor? As I've said before, therapy is not cookie cutter. So we don't create treatment plans, one person for everybody. But there are some things that everyone has to do. Using the bathroom, that's one of them. So we want to ensure that our patient has access to a bathroom, a full bathroom on that first level. We would need to know that in case they have to go upstairs and they don't have a full one. So, ¿tienes un baño completo en el primer piso? ¿Tienes un baño completo en el primer piso? ¿Tienes un baño completo en el primer piso? The next one, do you have a handrail? So patients generally fall risk. So having a handrail when they're going up or down the stairs is very important to know. Okay. ¿Tienes una barandilla? ¿Tienes una barandilla? ¿Tienes una barandilla? The next one is asking a patient, do you have a raised toilet seat? Especially many of our patients have hip precautions and they have to stay at that 90-degree angle. And we would need to know if the toilet is very low, we need something to kind of raise that up so it makes it much easier to sit down. So you want to ask them, ¿Tienes un asiento de inodoro elevado? I'll say that very slow. ¿Tienes un asiento de inodoro elevado? I'll say it again. ¿Tienes un asiento de inodoro elevado? Okay. The next one, do you have a shower or a tub? Makes a big difference whether or not we're trying to get someone to step over into a tub, or do they have a shower they can just walk into. So we're going to ask them, ¿Tienes ducha o bañera? ¿Tienes ducha o bañera? ¿Tienes ducha o bañera? So basically, do you have a shower or a bathtub? The next one, do you have a shower seat? ¿Tienes un asiento de ducha? ¿Tienes un asiento de ducha? Last time. ¿Tienes un asiento de ducha? I think I have. And we have one more on that page. Do you have double vision? ¿Tienes visión doble? ¿Tiene visión doble? ¿Tiene visión doble? So you also heard, I don't know if I'm doing it purposely, but I remembered it. Sometimes I'm saying tienes or tiene. So tienes is the more familiar way of saying it. Where, excuse me, tiene is the more familiar way of saying it. As I said, sometimes with patients, initially you start off and you're very formal, and then you become a little bit more informal as time goes. But again, most patients in this situation are not so concerned about the informality or the formality of questions. I think more times I've seen gratitude for the fact that you are attempting to learn the language. So with that being said, I would also suggest if you have a certified medical interpreter with you, then by all means use them. Okay, so I'm at 8 minutes and 48 seconds, so I'm going to try and squeeze the do you know what I said, and that will have me say a sentence and you try to figure out what I said. Okay. ¿Te sientes peor? ¿Tienes visión doble? ¿Te mareas cuando cambias de posiciones? ¿Tienes un asiento de ducha? ¿Tienes un baño completo en el primer piso? ¿Tienes ducha o bañera? ¿Tienes ducha o bañera? ¿Tienes una barandilla? ¿Tienes un asiento de inodoro elevado. So I just made the 10-minute mark. I'm trying to keep the videos at least 10 minutes or under. That way you have an opportunity to listen and repeat, listen, repeat, listen and repeat, whereas where your learning will come from without taking up too much of your time. With that being said, gracias por venir. I'll see you in the next video. Adios.